My name is Norm Volsky, your host, and this is the Digital Health Heavyweights podcast.
Thanks, Norm. It's an honor to be here, and it's been fun to work with you over the years.
Hello, and welcome to the Digital Health Heavyweights podcast with your host, Norm Volsky. And today we are thrilled to have Matt Sidney, who is the founder and CEO of Beanstalk Benefits. Welcome, Matthew.
Hi, Norm. How are you?
Doing great. So for all of our viewers and listeners that don't know Matt and his background well, Matt is founder and CEO of Beanstalk Benefits, which he launched this year after 25 years working in senior management and health technology. He spent the last 15 years building and growing companies that improve employees' access to innovative benefits. Matt was previously CEO and president of Pickwell, an AI-driven benefits decision support solution that helps employees choose health benefits by predicting future healthcare considerations and estimating costs. He's also held executive positions at Health Equity, which is the #1 health savings account administrator, and at LifeCare and in telehealth. Matt holds a master's in public health from Emory University and a bachelor's from University of Michigan. So we're excited to have you on the podcast and look forward to talking about your career.
Thank you for having me, Norm.
My pleasure. So what brought you into the healthcare world? Where did you decide to enter healthcare in your career?
I have a mother that's a nurse and a very passionate and a father that was in the world of HR, and it sort of took me down that path. And now my wife is actually in benefits as well. So
wow, it's family business. I love it.
Holidays, I'll tell you.
That's great. So Health Equity is a leading admin of health savings accounts and other benefits for benefits advisors, health plans, retirement providers with over 16 million members. Walk us through your time there as the EVP.
Yeah, so I joined Health Equity at a time when it was just forming, and specifically to focus on distribution, helping build a health plan channel, an employer channel, and the business exploded. And I'd attribute it to just an incredibly passionate leadership team and a very high quality program, and a special sort of place in my heart for a very strong customer service arm to the organization, which is led to its explosive growth.
Yeah. It's one of the most widely used benefits, in the world. How did the landscape of healthcare change during those pivotal years, between the early 2010s and the late 2010s?
Yeah, I mean, I think technology has had a massive impact on it. I think our ability to move very quickly, not just from a customization or configuration perspective, but actually meeting the consumers where they are, personalizing the experiences down to the individual, very different today than it was 10 years ago, as well as the ability to rapidly iterate. So as you learn from your users, as you learn from their experiences, how they're using the system, you can iterate in real time. And it becomes really exciting from that perspective, because now you're meeting that individual's needs the way that they want to be dealt with and supported, versus sort of a broader approach, right? More of a shotgun approach, which has been shown to work, but you don't get as many people that are that interested, that engaged.
When you were at Health Equity, your team was winning. Like, you guys were really doing a great job of commercializing and bringing in great customers and providing great service. How did that experience and all that success, how did that make you a better executive in your last two roles, where you've been the CEO of a smaller company? What did you learn in the Health Equity days that helps make you better now?
Sure. A couple things. I think the first being that learning about how the market acquires product, very different in the benefit space than in other spaces. The buyers are very calendar driven due to open enrollment, a little bit of risk averse to a certain extent, but are really trying to do their best to help support a very broad-based group of employees. And I'd say from a health equity perspective, you got to surround yourself with a great team. You really do. I am the dumbest guy in the room at every company I work at, especially.
I got that.
And especially as CEO, you have to surround yourself with folks that bring something different to the table than you bring. And I think we've done that. And we've specifically at Beanstalk, I've surrounded myself with folks that are truly benefits professionals. They're not healthcare, they're benefits professionals. And some of them are with me at Health Equity, some of them are with me at Pickwell, and some of them are new faces, but they're a fantastic team.
That's great. So what inspired you to leave, a winning situation at Health Equity and join Pickwell as president and CEO?
Yeah, I'd been with Health Equity for quite some time. Partnered with John Kessler, the CEO, who's an incredible leader, and wanted to see if I could cut my teeth on giving it a try. And it's a very different experience than running sales and marketing. And so far so good.
That's fantastic. So what was a little different than you expected, once you sat in the CEO seat for the first time?
I think when I took the role at Pickwell, it was just get product out in market. Things will be great. Quote
Hmm.
investors. And the reality is that's not the way it is. There's a human element to this where there are folks when you come into a new situation that are uncomfortable with somebody different, are in a position that they may not, they may have been doing the same thing for quite some time and they've been a little bit insulated. And so bringing in sort of fresh ideas can be a little bumpy. And so trying my best to be sensitive to that, trying my best to make sure that I'm doing a lot of listening in the
Hmm.
first 90 days, and all along the way, quite frankly, but making sure that you understand the social, cultural, and political system that's within the organization, and not
Hmm.
just sort of driving your ideas through the group.
What advice would you give people who are watching and listening this podcast that eventually want to aspire to be a CEO one day? What are the things they can do today that can help them prepare for that moment in the future?
Yeah, I mean, I think the first is don't bow out.
Hmm.
There are going to be opportunities for someone to learn by sitting in and listening, taking part of things that aren't normally necessarily part of their job,
Hmm.
but don't bow out. Use every opportunity that you can to learn. Don't be afraid to stretch. And
Hmm.
that is a really important piece. I mean, I have no business being the CEO of Pickwell or Beanstalk, but it took a little stretching, right? And that I think critically important. And the last is, I think, goes back to listening. Making sure that you're in tune with what's going on with your team or your direct reports or the broader organization. Kind of keeping your ear to the rail is really critical.
All right. Well, you're one of the more modest CEOs I've ever met. You're able to put your ego aside and, really commend others and take zero credit yourself. I will say, like pattern recognition, Health Equity did sell to Optum United for pretty good chunk, right?
Well, they went public, Health Equity.
Yeah.
Yeah.
So let's do the scorecard. Health Equity went public. Pickwell, you got it sold to Jellyvision, so you're doing something right here. You got to take some credit for that.
I mean, it is a function of the team. I think the piece that's really exciting to me is watching the galvanization of the teams. And they're two totally different situations. Pickwell was an organization that was a little bit distressed when I took it over.
Mhm.
We turned it around and obviously had a nice outcome. Beanstalk, very different, starting from scratch. Hadn't
Yeah.
done that before, but it
Mhm.
is so fun to see the team galvanize and work together. I mean, it's not easy. And this current market is certainly not an easy time to sell or raise capital. And knowing that you have a very strong team, it helps quite a bit.
It sure does. So Pickwell is a decision support tool for health plan choice. How
Mhm.
does it work?
Pickwell essentially was born out of the University of Pennsylvania. A group of economists had gotten together and started looking at how do people make decisions around Medicare plans? How do you pick
Mhm.
your Medicare plan? And did a large study on it, and then ultimately developed a machine learning algorithm that helps not
Mhm.
only predict risk being individual spend, but also preference based. And so built an incredible model that helped someone identify the optimal plan for them, both in the Medicare space and then ultimately the commercial space, but not just on cost. Also, how does it fit? And think of it almost as reading the fine print for you, which is
Mhm.
very important when you're a senior living on a fixed income, finding the right plan based on your behaviors, based on your conditions, based on your prescriptions.
Mhm.
And so we took that out to the broader commercial market with a lot of success.
So how did Pickwell objectively rank health plans that best fit a consumer's personal needs and not only their needs but their values?
Yeah, so a lot of surveying. The gentleman that was our chief economist, Dr. Sam Kina, did years and years of work on this, in which he looked at how people pick plans, what are the results of those plans, and then ultimately that's how they developed the machine learning algorithm
Mhm.
that it used a methodology called random forest clustering. So think about tons of claims data. I mean, we had a lot of claims data. And what we were doing is looking backwards and forwards against that and fine tuning the engine so that it was incredibly impactful and from a prediction perspective was one of the best around.
It's fantastic. So in 2023, Pickwell was acquired by Jellyvision. Congrats. What was that due diligence and acquisition process like?
Actually, it was 2022.
2022, excuse me.
Long diligence process. In fact, I had run into a personal caregiving issue with some family and stepped away, and Brian Morgan, who was my right hand, took over the process. So just to tell you how long that process was, it's involved. I would say, the big learning from that process is just make sure you have your ducks in a row. Make sure you're not waiting to the last minute to build a data room, and seek a partner that truly understands your value. And I think Jellyvision really did. I mean, Amanda Lannert, who's the CEO there, has done a phenomenal job with that company, and she saw the value in Pickwell, which was fantastic.
That's great. So you've been in the benefits space for a while. You were at Health Equity for many years. You did a great job at Pickwell. What inspired you to start Beanstalk Benefits?
The benefit space, there's a little misalignment of incentives.
Mm-hmm.
A lot of, you hear the terms pay to play, good enough. And so we looked at where the technology is at this point. What are some of the main challenges, sort of the headwinds that not only employers are facing or employees are facing, but brokers are facing, consultants are facing, point solutions are facing. Mm-hmm. And what we realized when we went out and did our research was there are really two key issues. So we formulated two hypotheses. The first being, there's no platform that we could find that allowed for the delivery of point solutions at scale. Every time an employer wants something new, they have to go through the full process, right? Mm-hmm. Now, there are marketplaces, but you're saving a little bit on ink, and that's about it. You still have to go and pay your PEPMs on the original service, and then subsequently whatever you buy from the market. We look at that at slightly, our view of the world's a little bit different. We said if we can leverage technology to make it easy for employers, so be very employer friendly, we've got something there, because that allows everything else to fall into place, including making this employee driven. So employees pick whatever they want, whenever they want. As their needs change, it's not tied to open enrollment. They can get support for caregiving or parenting or lactation consulting if that's what they need at any time. And then ultimately, the last piece was, as big and as successful as Health Equity was, or how great Pickwell was, kind of point solutions run into the same problem. Things like pay to play, looking for most favored nation pricing. That's tough on small businesses. And so we looked at it and said, there's an incredible number of wonderful services and technologies out there that are going to have a very difficult time selling into the employer space, whether it's cost, whether it is applicability to the employee base, whether it's, hey, it's only 10% of my employees that are afflicted with whatever the issue is. And reality is that 10% are no less important than the other 90%. So short shrift.
And they could be causing 70% of your costs.
Absolutely. And so we looked at it and said, we need to partner solution or point solution friendly as well, and put them in a position they can spend their time, energy, and money on what's most important to them, which is servicing the end user, not necessarily dumping a ton of money into marketing and sales, where we can help them out with that.
I love that. So what type of listeners that are watching and listening to this podcast should get in touch with you and your team immediately? Yeah. Is it benefits leaders? Is it vendors? Like, who is the entities that most benefit?
That's the beauty of Beanstalk. All of the above.
Yeah.
So
explain how each member of the ecosystem benefits, and then maybe we'll compel a couple people to reach out direct to experience this benefit.
Got it. Yeah, let's start on the point solution side. So for vendors or those offering a service, we let them set the price, set the structure for that price. Is it a per visit, a per test, a per diagnostic, right? A per membership. We work with them and have created a community of these folks. We actually just had our first partner summit last week, very well attended, and a lot of great conversation and how to get better and continue to grow the community. We want them working.
Are you able to name or disclose any people or groups that are in it already?
I prefer not to because there are,
Okay.
I mean, we have 29 solution providers currently with
Yeah,
another 10 coming in. So I don't want to leave anybody out, and I know I would.
fair.
But we try to create an environment that they can work together, cross-refer, bundle, and bring their ideas to one another. So we've, in our community or our marketplace, there's no CAC, there's no cost of sale, there's no cost of legal, there's no cost of account management. So to them, we look like one big group that continues to grow. So we handle that all for them. On the other side, for the employers, we look like one big massive point solution. So an employer that's looking to offer solutions that meet their employees' diverse set of needs. We've got 5 generations in the workforce for the first time in American history, more social and cultural diversity than ever. And if you're thinking between 500 to 1,000 employees per every benefits professional, how do you meet all their needs? It'd be incredibly difficult. And so what ends up happening is they end up picking one point solution because that's all they can handle at this point. We can bring them 40, 50 services today, 100 services tomorrow. And it's one contract, it's one implementation, one bill to pay, it's one report to look at, and it's one throat to choke because we'll go and deal with the solution providers directly on their behalf. And then lastly, and probably most importantly, is the end users. Right? So the end users have the agency and the facility to pick and choose what they want. We have an AI engine that helps be more proactive, but it also gives them the opportunity to search the way they want to search and communicate with us the way they want to communicate, whether it's Slack or text or email. And so we try to do our best to sort of, quote unquote, meet them where they are, but provide them with the services that they might not necessarily always think about from their employer, but are critically needed.
Well, a lot of people on this podcast have said like digital health needs consolidation. There's got to be like one place to go to a one-stop shop. This sounds a lot like it. Playing devil's advocate, like why would an employer or a vendor not want to work with Beanstalk? Like it just seems like it makes too much sense.
It's about what they have currently. So if I'm a 50,000 life group and I have 50 point solutions, I've got contracts, I've got processes in place. That's very, very difficult for them to turn around and say, we're going to rip and replace. So as part of that, we actually will take whatever the employer currently has, load it up into our system. So it feeds our engine, our search, and really sort of provides free advertising on behalf of those solution providers and the employer to the employees. The employer's already paying for it. They should get value out of those services. But that would be a reason that an employer would say, I've already got a lot of stuff. I'm not really interested in upsetting that apple cart. We have found a lot of success in what I'd call the SMB market. So say the 5,000 employee and below market. They don't have a lot of stuff, a little bit of a blue ocean. And quite frankly, I think that every employee should have access to world-class benefits, whether they work for a 50 life group or a 50,000 life group. And that's kind of what we're here to do, is level the playing field for everyone.
Couldn't agree more. Walk us through your first year. What was your process in building Beanstalk? What lessons have you learned along the way? What successes are you proud of?
So first year was all about gathering information and building out the platform. So we used 2023 to do just that. Met with anyone and everyone that would talk with us about what the problems were, how are we going to solve this. And this concept of alignment of incentives we've heard loud and clear, different voices and different volumes, but we're hearing it loud and clear. And so at the end of the day, it should be about outcomes, right, for the consumer. We spent a lot of time tweaking, thinking about the platform, the experience, and how to best get the word out about what we were thinking about building or what we were in the midst of building long before we went live in 2024. Lessons learned, there's a lot of them.
Yeah.
I would say first is make sure you surround yourself with folks that are bringing something different to the table, which I think we've done. Incredibly talented team, incredibly passionate about solving the problem, all a little bit different in terms of their thought process, but want to solve the problem. Right?
Yeah.
You've always got to be out talking to investors. It's always a challenge for folks. I think new entrepreneurs sometimes push that off. You got to talk to the investors because you can garner a lot of information, not just help them fill out their spreadsheets, but you can garner a ton of information, and you start to form these relationships and bonds, and they start to think of you and they bring information to you, which is fantastic. And there's just some incredible minds out there to tap into. Watch your runway. That's probably last runway, right? And I think, being thoughtful about your spend and your burn, things never move as fast as you want.
Yeah.
And you always spend more than you plan. So
Mhm.
keep a close eye on that.
Yep. Really good advice. Walk us through what it was like securing funding in 2023. You secured over 7.5 million, with Redesign being one of the investors. Walk us through that because like 2023 was not easy market conditions to raise funds.
Yeah. So Redesign has a really interesting model. They tend to incubate their own ideas, greenlight them,
Mm-hmm.
find a senior management team, and then invest. This one's a little bit different. This was not one of their ideas. We brought this to the table, but they're just sitting, they're incredibly driven and focused on trying to solve some of the most difficult problems in healthcare. And I
Mm-hmm.
think when we brought this idea to them, the reaction was strong. The reaction was one where they said, this isn't necessarily the area that we tend to focus a lot on, but it becomes a conduit for people receiving care, which I think fit their thesis.
There are a lot of companies trying to improve, benefits and healthcare. Like, what makes Beanstalk different? What makes Beanstalk super unique?
Yeah, I mean, our ethos is a little different from the perspective of, I go back to, we want to be employee driven.
Mm-hmm.
Employees know their problems. They may not know who's going to solve it or how it's going to get solved, but they know what their problems are. If we can build a system of not only technology, but the solutions around it that can meet those needs, and I can make sure I can bring that person right to the front door of that service, everything that happens in Beanstalk is consistent up until the point the service is delivered.
Mm-hmm.
So payments, how you're finding information, how it's shared with you, all of that is identical,
Mm-hmm.
whether it's parenting or elder care or MSK. And
Mm-hmm.
that was purposeful because that's what people are used to seeing in other industries. And we've just been a little behind and been a little bit behind in the benefit space. And so we're looking to change that.
Yeah, benefits space certainly needs innovation. What are your tips for founders going out to raise money right now in
You know,
this current climate?
conversations early and often, get out there.
Mhm.
It's not doomsday right now by any means. It's
Yeah,
getting better. We are going into an election cycle. Obviously, we're in the cycle, I should say.
yeah.
And that creates distraction, but get out there. Get out there and have the conversations. Go out to HLTH, go out to San Francisco in January.
Mhm.
Let people know who you are and what you're doing. The other is stay organized.
Mhm.
Like I said earlier in the conversation, don't put your data room together at the 11th hour because that just slows you down. And be open. Be open to the conversations. Be open to not only listening but finding new sources, new ways to consider capitalizing your business.
How does Beanstalk differentiate itself and approach benefits programs, point solution fatigue, and address a greater variety of needs for employers in our convoluted digital health landscape?
Yeah, a couple things. I mean, technology is a wonderful thing,
Mhm.
right? It's made just from Pickwell to Beanstalk. It's very different. We can move much faster. In our model, there is no point solution fatigue.
Mhm.
Because the fatigue isn't necessarily just driven by per employee per month payments. It's driven by the fact that you have to manage all of these and deal with it and implement it.
Mhm.
You don't have any of that in the Beanstalk environment. Like I said, one implementation, right?
Yeah.
Bill to pay. But the idea of trying to align those incentives, I mean, we looked at it all the way down to the level of broker commissions and payments.
Mhm.
We don't pay on belly buttons. We pay on transaction volume. So as
Mhm.
the transactions go through, then I pay a portion of that to brokers or consultants as an example, or a reseller. And we did that purposely because I want them to stay involved with their clients.
Mhm.
This isn't a set it and forget it. None of this is in the healthcare and benefit space. And so everybody needs to have active involvement. And we support that. We put our money where our mouth is with that.
You walked us through that employees can go on Beanstalk and pretty much choose their own adventure, which is fantastic. Like, what do you do to prevent someone from overusing, like using too many apps that maybe, they don't need?
Well, because it is paid for, we give them a digital wallet, and
Mhm.
that stack sits a lifestyle spending account, and that's the way the employer can subsidize on a per employee basis. And then they can tie in their HSA, they can tie in their FSA because most of our solutions are 213D qualified
Mhm.
medical expenses. They can tie in their own personal credit card. We have a vehicle through Lane Health so that they can spread their payments. I'm less concerned about someone overusing the service
Yeah.
because that means they're getting the help that they need or the help that they want, right? I'm more concerned about people not seeing it, not realizing that, oh my goodness, there was a lactation consulting service that through Beanstalk, or there was early childhood development and developmental delays support for parents. Those are things that are a little bit different that an employer doesn't necessarily always offer. And so I want them to be able to look to that, because it's the value that's created that I think helps the employer attract and retain the employees they're looking to do.
That's fantastic. Do you have a statistic around like when vendors are on Beanstalk, the app is downloaded and used a certain percentage more often than another medium?
Currently, no, because we're relatively new. We're bringing in our commercial clients now, and it's interesting because what we found, one of the toughest parts about doing this was standardizing things,
Mm-hmm.
because it's not all apps. There are apps, there are services, there are live human beings, right? So trying to connect all those dots was very difficult, but we leveraged the technology to allow us to use the engine to do just that. So now the recommendations, as we think about the future, recommendations aren't just going to be, here's a service.
Mm-hmm.
Here's a service, here's a bundle of services, here are other things, here are products that you could possibly leverage. We actually really excited that we just launched our first product on the system, which is Aura, the ring for sleep and measurement, and really excited to be able to do that and partner it with our sleep solution, right? So how do you do those services? That's what we're really excited about at this point.
Love it. Walk us through the member experience, from the employer side and from the employee side.
Yeah. So from the employer side, we've tried to make this as easy as possible. I think employers, especially on the smaller end, tend to struggle sometimes with demands for large eligibility files or data. And so we've made it very, very simple. A short form eligibility file is what we request. And think like first name, last name, email. I mean, it's very small, the amount of data we require. We've actually released our ability to offer a direct-to-consumer type product. It's really more B2B2C, but a registration without eligibility for those employers that just can't do it. So making it very easy. We work with them around communications and how they like to articulate the value proposition of Beanstalk Benefits to their employees over the course of a year. This isn't a one and done. It's got to be constant and consistent. From an employee's perspective, really easy. They receive notification from their employer that they have access to Beanstalk Benefits and a little bit about Beanstalk Benefits. They come in. It's as simple as putting in a username and creating a password, and you're in. And you have the luxury as a user to either maybe change how we're communicating with you. So I like email. My engineers like Slack. We can do both. Right, as an example. They can search for things if they know what they're looking for. If they just want to go and discover, they can do that as well. So they can see everything at any point. We've bucketed it by segments. So there's lots of different ways that we can share information about the services that are there, highlights, all kinds of things, but making it very easy for them to look at something and say, you know what, that's right for me, and literally click and pay for it. And they're off and running right then and there.
How does the pricing work? Like if you were to go to an employer and they're like, yeah, we're super interested, like what does it cost? Can you walk us through that model?
Sure. So we have a small access fee that typically is a one-time fee per year. And that's really to cover the cost of ingesting their benefits, any configurations we make, the implementation. And that's not really where the action's at. The action's in the transactions, right? So each solution provider sets their own price.
Yeah.
Okay. And how that price is charged. So it could be a monthly membership we have a really interesting service through a company called Spiritune that does music therapy for anxiety and depression. And so that's a monthly subscription. When the person is, they say, yeah, this wasn't really for me, we've made it very easy to cancel. So you don't have to go to the gym to cancel. You can just click cancel and it's pretty much done. We charge a small transaction fee on top of the discounted service. And that's about it. I mean, it's pretty straightforward. What we didn't want to do is be in a situation where we're charging employers a large PEPM or demanding that they have to put money in the LSA. They don't. We have a lot of flexibility. If the employer doesn't have the money to contribute to the LSA, but they're offering HSAs and FSAs to their employees can tie those in. And that makes it also easier, especially for PEOs and smaller organizations.
That's great. You've been in the benefits space a long time. There's a lot of people who have come into the market trying to sell something to benefits leaders. What would you say is something you'd tell them to avoid, when they're working in this benefits and employer market? What have you seen from some people who maybe entered the market in the last 5, 10 years that you think isn't overly effective?
I think the challenge is, as any industry, you've got to know your buyer.
Mm-hmm.
Making an assumption that you have a great mousetrap does not sell it. This space is heavily driven by the amount of dollars you put forth in sales and marketing, not just the value of the product. We've seen that before. And there's something to be said for experience in selling to this space.
Mm-hmm.
Benefits leaders across the country are overwhelmed. Their budgets are scrutinized more highly than ever before, and they're asked to do more with less. Yet, the number of service options, the hyper specificity of these solutions is far beyond anything we've ever seen.
Yeah.
They're kind of caught between a rock and a hard place. And part of the point of Beanstalk is to help them through that. But we've learned that over time. And, we have a sales team that is, it's not huge by any means. It's a small sales team, but they've been in this space for a very long time, and they've been doing it at a very high level while they've been in the space. And that helps out a lot because you've got so many different tentacles and different avenues to go down, whether that's brokers, consultants, direct to employer, affinity, reseller, what have you. And so that's, working with them to build that strategy, I think has been an incredible journey, and one that we're starting to see the fruits of our labor.
It's fantastic. What's next, and what is your vision for the next 5 years at Beanstalk?
Yeah, I mean, we're going to continue down the path of enhancing the experience based on what we're hearing from our users, employers, brokers, consultants. Connectivity continues to get better and better over time. Our ability to build these bundles so that we can start to share services between individuals, start to package things, I think is going to be really important. Data is king. We have a lot of data on, how people purchase services, what they like, what they don't like, and just continue to expand. I mean, the best part about this job is meeting the CEOs of these companies, just hearing their incredible journeys. I mean, it's amazing. It's inspiring. And we look to continue to build out our community.
What trends are you currently observing in the, digital health and benefits space?
Yeah, I think there's definitely something to be said about consolidation. Some players do that. We talk about just the volume of players in the market, and there's 10 to 12,000 digital health solutions out there. But it really gets to the hyper specificity. I mean, there are services that would not have survived 10 years ago in the benefit space that I think are going to thrive. I think they're going to do well. They just need a little bit of support from groups like Beanstalk. I think you'll see a lot more in terms of employees taking control. Whether it's ICRAs, whether it is HSAs, whether it's things like Beanstalk, technology makes that a little easier, right? A lot of the pressure off the benefits world and benefits professionals. And so I think we'll see a greater amount of personalization for sure.
That's great. Any bold predictions in the benefits space in the next decade?
Oh, any bold predictions?
Or even, lukewarm predictions?
Lukewarm. I think, like I said, I think you'll see a greater emphasis on the technologies that supports the personalization. I think you're going to start to see this concept of how do we leverage an ICRA, right? How do we get it out there and in large numbers so that individuals can take advantage of them? It's very powerful. You've got companies like Stride out there that are focused on the ACA and doing it the right way with their technologies. They happen to be a partner of ours, but ways to make benefits not only be more valuable than they are today, but appear more valuable as well, and substantively so. Because today it's about attraction and retention. So if I don't value my benefits, then that's not helping to solve that problem. And I think we'll start to get there.
Can you walk us through a little bit for the vendors, like why it benefits them to be on the platform? It sounds like, yes, you do a great job of helping increase conversion rate and like getting more patients on the platform. But what else can you do for vendors in addition?
Yeah. One is the whole basis of the community, and why we use that word versus a marketplace is we want them coalescing and working together. The sharing of ideas. We've already had several of them connect to one another to form a little bundle outside of Beanstalk. And that's okay, because all boats will rise with the tide on that. But the other piece is that this is hard space, right? Some are going through capital raising right now, some aren't. So there's the ability to share information. There's the ability to share experiences. Sometimes being at the top of the organization is a little lonely. And you look to start to build bonds with other CEOs and other leaders to help bounce ideas. I think that's been a really exciting part of this, and extending their reach.
Mm-hmm.
Oftentimes these organizations are started by clinicians or someone who had a personal experience but haven't sold in benefits before, haven't sold insurance companies before, and so we're helping to expand their reach and really ultimately get their services in front of the people that actually really need them.
And you mentioned there's 12,000 different digital health companies, give or take. How do you evaluate them and score them so that you're only letting the cream of the crop onto the platform?
Yeah, so we developed a vetting process that I think is comprehensive but not overbearing.
Mm-hmm.
Once again, these are smaller organizations. They tend to be that they don't have the wherewithal to spend a lot of time in that. We identify segments. We look for players in those segments. We then invite them to participate in the vetting process, and we pick one. We're looking at everything like operational efficiency, outcomes, clinical oversight if it's a clinical service.
So it's one vendor per category. So this is high stakes.
Exactly.
And how long can a company stay as the one vendor before you reevaluate and maybe throw out a RFP every couple of years to make sure it still is the best?
So part of our ethos is to provide feedback on an ongoing basis in real time. So as people use it, provide feedback. We want to get that to the service providers as quickly as possible so they can do better. We will go through a reevaluation process on an annual basis just to make sure it's not meant to be punitive to say, hey, we're going to kick you off and get somebody else on. It's really to make sure that we're doing our part to share information with them. We're doing our part to make sure they hear the voice of the customer, not just the user, and make sure that we have what we think is the best solution. These are our partners. I mean, listen, they took a risk on us as well by working with a smaller company that's just came out of stealth in 2024. But we don't ask them to be exclusive to us in any way, shape, or form. They're free to do everything that they would normally do, and hopefully, we can continue to bring business their way.
I love that. So your company, maybe you even yourself, has evaluated hundreds, if not over 1,000 of these companies. What are some areas of digital health that you're really passionate about and you're excited about?
Yeah. The overused term high touch, high tech, right? The touch part sometimes gets lost, and technology is critically important, but does not replace human touch all the time. And so we look for that. That's something that's very important to us. I think the other is that just depending on the organization and what service they're providing or what outcomes they're looking for, are they getting better over time? Are they not resting on their laurels? I think one of the traps that companies in the benefit space sometimes fall into is it's not who has the best product, but he who spends the most in sales and marketing tends to win the game. I'm looking for organizations that aren't going down that path. Specifically because we put them behind the eight ball a little bit when we put the pressures on them to sell, but that takes away from enhancing the product. That takes away from making the product better and more effective in meeting whatever outcomes they're trying to achieve. I want them focusing on what they do best, what they're passionate about, because ultimately that's what's going to be best for the employee or the user.
Okay. Do these companies still need to have their own sales teams, or are you saying, hey, come to us and we'll sell it for you?
I'd love to be able to say that. And hopefully in the next 5 years, I'll be able to say that.
Yes.
Today, we don't have the block yet to be able to say that.
Okay. Fair enough. So I ask everyone who participates in this podcast, not only, talk about your day-to-day life and, what you do professionally when it comes to healthcare, but also personally, do we practice what we preach? So how do you personally participate in wellness? Any ways you reduce stress or exercise in a very stressful job?
Definitely fresh air. I like to walk. Going for a walk when things get tight outside is a great way to kind of loosen things up, get a little exercise in. The occasional gym visit, and trying to keep up with my wife, who's very active. That's always a challenge. And trying to keep up with the children. So
good,
which is never easy either. So
definitely not. I chase my little rugrats around all the time, so keeps me active, and it does help with the stress for sure. I think something that's super important, for healthcare and wellness is what we eat, what we put in our bodies. I think in the US, we just have a really, really hard time even deciphering what's healthy and what's not, based on all the propaganda and all the advertisements, of health foods that aren't really healthy. So are
Right.
there any homemade recipes that you make at home that really are popular in the Sidney household that might inspire someone to try it, and maybe they try a new thing that helps them eat healthier?
Wow. Yeah, I enjoy cooking.
Mhm.
So lots of recipes. I think the fewer ingredients, sometimes the better. So try to keep it whole, try to keep it fresh, moderation with anything else. I
Mhm.
mean, you look at this face eats a lot of pasta, way too much. And so it's everything in moderation. But my wife and I have always been kind of sticklers for having a lot of fresh fruits and vegetables around the house. Um, a lot of organic food around the house. So the kids have grown up. We taught them to cook, so they know how to cook, and so they're
Their
learning.
future spouses will be very thankful to you.
Yes, so how do we help them eat healthy, make
Mhm.
better choices as they're in school and we're not around, and so that helps to form our approach to food as not just being energy, but it can be enjoyable too.
Mhm. I love it. Well, again, Matt, thank you so much for joining us on the Digital Health Heavyweights podcast. We're going to be eagerly watching and enjoying your growth over the next bunch of years at Beanstalk Benefits. And thank you for joining on the Digital Health Heavyweights podcast. And good luck with your blossoming endeavor.
Thank you, Norman. Thank you for having me today.
Yeah, of
Appreciate it.
course. Thank you. Thank you for joining. Please like, comment, and subscribe below if you enjoyed it.